Hi, future nurses. Welcome to Next Gen NCLEX in 30. I will teach you how to think like a nurse, not just memorize content, so you can answer questions with confidence. Today, we're breaking down how the Next Gen NCLEX actually tests because it's not about how the old NCLEX used to be. Things have changed. Now, the NCLEX focuses much more on clinical judgment and decision making, not just memorizing information. So during the session, we're going to focus on understanding how the NCLEX works, recognizing the common question formats you'll see, and practicing the kind of priority-based thinking nurses use in real clinical situations. Let's get started. All right, this is how you pass NCLEX. You pass by thinking like a nurse. That's the clinical judgment model. First, recognize cues. Ask what's abnormal. Look at vitals, labs, symptoms, and ask what stands out. Next, analyze cues. Ask what does it mean? Is it dangerous? Just connect the dots. Then prioritize. Ask what's most likely happening. What could harm the patient first? Then generate solutions. Ask what could you do? Next, take action. Choose the safest priority intervention. Then evaluate. Ask, did it work? Do you need to reassess? Here's the key. You don't need to memorize the steps. Just follow the patient's story. Ask yourself these three things. What's happening? What's dangerous? What do I do first? If you can answer those three questions, you're already thinking like a nurse, and that's how you pass NCLEX. Let's talk about what actually scares students the most. Not content, but formats. The Next Gen NCLEX didn't just change what you're tested on, it changed how you're tested. But here's the good news. These formats are not harder. They just force you to think. We will break these down in practice. Here's the list. You'll see case studies, matrix questions, drop down questions, highlighting. Then we have ordered response, select all that apply, drag and drop, and sometimes bow tie questions. Now listen closely. The format is not the enemy. If you follow the patient's story by recognizing cues, analyzing, and prioritizing, you can answer any format. This isn't about memorizing question styles. It's about training your brain to think like a nurse in any format they give you. Let's talk about case studies because this is where students panic. But this is also where you can score big points. First, understand the structure. It's one patient, not five, not random scenarios, just one patient story from start to finish. That means everything connects. Next, information is revealed in phases, just like real nursing. You don't walk into a room and instantly know everything. You get reports, then vitals, then labs, then maybe a provider note. The test is mimicking real life. And here's the powerful part. Each question builds on the previous data. So if the patient had shortness of breath in question 1 and now their oxygen saturation is dropping in question 3, you're not starting over. You're continuing the story. This is why you cannot treat each question like it exists alone. You are thinking, what's changed? What's getting worse? What matters most now? Case studies aren't harder. They're just asking, can you follow a patient over time? Can you notice deterioration? Can you respond safely? And guess what? You already do this when you answer practice questions. You just need to slow down, follow the story, and think like a nurse caring for that one patient. This is the scenario. I'm not going to read through the whole scenario, so pause right here if you need to read through it. Okay, before answering anything, think. We have a 68-year-old male with shortness of breath, chest discomfort, and COPD. So this is a respiratory problem until proven otherwise. Vitals, he has elevated BP, heart rate, and respirations. Oxygen saturation is 86%. That's hypoxia. Let's look at the assessment. There's accessory muscle use, diminished breath sounds, restlessness, and productive cough. All this means there is an increased work of breathing. The restlessness points to early hypoxia, and there could be possible infection or exacerbation. Let's look at the ABGs. The pH 7.32, that's acidotic. PaCO2 is 55, that's high. PaO2 is 58, that's low. So this is respiratory acidosis with hypoxemia. He's retaining CO2, not oxygenating. He is deteriorating. The priority is oxygenation. Airway and breathing come first. So think, how do I improve oxygenation? What action is priority? How do I prevent respiratory failure? That's how you win case studies, by recognizing cues, analyzing, and prioritizing life threats. Right now, respiratory compromise is the biggest threat. All right, we are in step 1 of the clinical judgment model. Recognize cues. Don't overthink this, just recognize what matters. So look at these findings and ask yourself, which ones are most concerning? Let's go one by one. SpO2, 86% on room air. Is that concerning? Yes. Anything below 90% is hypoxemia. This patient is not oxygenating adequately. That alone can lead to organ dysfunction. Next, respiratory rate 30 per minute. Is that normal? No, that's tachypnea. The body is trying to compensate. When someone is breathing that fast, they are working. Next, productive cough. Now pause. Is that abnormal? Yes. But is it immediately life-threatening? No, not by itself. A cough tells you something is going on, but it's not the priority cue in this moment. Now, PaCO2, 55. Normal is 35 to 45. So this is elevated. That means CO2 retention. That means hypoventilation. That means respiratory acidosis. And that is concerning. Now, use of accessory muscles. This tells you there's increased work of breathing. The patient is struggling. This is a visible sign of respiratory distress. So, what are your most concerning cues? SpO2 86%, respiratory rate 30, PaCO2 55, and use of accessory muscles. Notice the pattern? All of them point to one major problem: oxygenation and ventilation compromise. That's how you recognize cues. You don't pick everything abnormal, you pick what threatens life first. And right now, breathing is the threat. Now we analyze cues quickly. The nurse interprets these findings as indicating which condition. Select one. A. Stable COPD. B. Acute hypoxic respiratory failure. C. Anxiety hyperventilation. D. Pulmonary embolism. So let's think like a nurse. Step 1. Oxygen is first. SpO2 is 86%. That's hypoxemia. In ABGs, you have low O2, high CO2, and acidosis. So this is failure. It's not stable. Step 2, look at the worker breathing. Respirations are 30. You have accessory muscle use, tachycardia, and restlessness. This patient is struggling to breathe. Step 3, let's eliminate some choices. We can eliminate A because patient is not stable. We can eliminate C because in that case, CO2 will be low, not 55. And we can eliminate D. PE, you usually have low to normal CO2. So what's left? The correct answer is B, acute hypoxic respiratory failure. This patient has hypoxemia, hypercapnia, acidosis, and increased work of breathing. That is respiratory failure until proven otherwise. Here's your NCLEX formula. When you have a low O2, high CO2, and increased work of breathing, you have respiratory failure. Memorize that pattern because NCLEX loves the setup. All right, now you identified respiratory failure, but NCLEX goes further. What's the priority? Knowing is step one, prioritizing is how you pass. Which is priority? A, impaired gas exchange. B, ineffective airway clearance. C, risk for infection. D, activity intolerance. Step one, ABCs. Ask airway, breathing, circulation. This is breathing. SpO2 is 86%, PaO2 58, CO2 55. We have acidosis. We can eliminate C because it's a risk, it's not happening yet, and we can eliminate D because it's not life-threatening. Now A versus B. Yes, sputum equals airway issue, but what's killing them? Low O2, high CO2, acidosis. Correct answer is A, impaired gas exchange. This patient's primary life threatening issue is impaired gas exchange, not just mucus, not just coughing, but gas exchange. When prioritizing nursing diagnosis, remember actual more than risk, physiological is more than psychosocial, ABCs come first, and the problem causing instability wins. And right now, gas exchange is unstable. So if you see SpO2 under 90%, PaO2 is low, PaCO2 is high, respiratory acidosis, your brain should immediately think impaired gas exchange is priority. That's how you move fast on test day. Okay, this patient is in acute respiratory distress with hypoxemia and respiratory acidosis. So what comes first? NCLEX always asks what will kill the patient first? Airway, breathing, circulation. This is a breathing problem. So your priority interventions, they are you apply supplemental oxygen because O2 sat is 86%, PaO2 is 58. That's hypoxemia. Do not wait. You oxygenate immediately. Also, place in high Fowler's position. This improves lung expansion and reduces work of breathing. No order needed. Other things are not first. Instead spirometry, not priority in acute distress. Notify provider. You intervene first if you can. Sputum culture. Data comes after stabilization. Bottom line, oxygenate and reposition first. So here are your correct answers. Apply supplemental oxygen and place in high Fowler's position. These are immediate, independent, and life-saving. Just remember, don't call, don't chart, don't collect, oxygenate first. That's how you pass NCLEX. All right, future nurses, this is where strong clinical thinkers level up. We are on Evaluate Outcomes. Translation, did what you do actually work? The question asks, after interventions, which finding indicates the best response to treatment? Notice that word, best. Not okay, not kind of better, but best. Let's break it down like a nurse. A. Respirations decreased to 24. Okay, that's an improvement if they were tachypnic, but 24 is still high. That's better, not best. B. SpO2 increases to 92%. Now we're talking. Oxygenation is your priority in a respiratory patient. If their saturation was low before and now it's 92, That's objective improvement in gas exchange. That's measurable. That's priority. C, patient reports less anxiety. Nice. We love that. But anxiety is subjective and it's not the main oxygenation problem. D, productive cough continues. That's not improvement. That means the issue is still present. So, what's the best response? B, SpO2 increases to 92%. Because when you evaluate outcomes, you always ask yourself, did I fix the priority problem? Airway, breathing, oxygenation. That's how you pass NCLEX. Not by guessing, but by thinking like a nurse. All right, let's talk about the format that makes people panic for no reason. Matrix questions. They look complicated, but they're not. Here's what you need to know. Rows equals findings or actions. Each row is something you're evaluating. A symptom, a lab value, a nursing action, a medication. You treat each row like its own mini question. Columns equals decisions. These are your judgment categories. For example, appropriate, not appropriate, expected, unexpected, needs follow up, no follow up, indicated, contraindicated. You're deciding how each row fits into each column. Now, here's the good news. Partial credit is awarded. This is not all or nothing like the old NCLEX. If you correctly identify some rows but miss others, you still earn points. That means strategy matters. Here's how you attack matrix questions. First, read the scenario. Second, go row by row. 3, don't try to solve the whole grid at once. 4, ask yourself, based on the condition, is this expected or a red flag? One row, one decision, move on. Matrix questions don't test memorization. They test organization and clinical judgment. And once you slow down and break it apart, they become free points. All right, let's break down how to attack a matrix question on the NCLEX. You're looking at a patient with heart failure, and instead of choosing just one answer, you're categorizing findings. This is clinical judgment in action. Here's how to think it through. First, ask yourself, what does heart failure actually cause? Heart failure equals fluid overload. Fluid backs up into the lungs and the body. So let's go finding by finding. Crackles. Are we surprised? No. Fluid in the lungs causes crackles. That is expected. Weight gain. Is that expected? Yes. Rapid weight gain means fluid retention. Also expected. Now look at bradycardia. In heart failure, the body usually compensates by increasing the heart rate to maintain cardiac output. So a slow heart rate, that's not expected. That's concerning. Here's the strategy tip. Don't memorize lists. Ask, what's the patho? What is the body trying to compensate for? Does this finding match the disease process? Matrix questions test whether you understand patterns, not isolated facts. Expected findings match the disease, not expected findings signal a change, complication, or something you need to question. That's how you think like a nurse, and that's how you pass NCLEX. Let's talk about drop down questions. I know they look simple, they feel simple, but don't let that fool you. Drop down questions are strategic. They are typically fill in the blank style questions, but instead of typing the answer, you're selecting the best option from the list. And here's what they're really testing. Can you interpret the data correctly? Do you know the priority action? Can you connect assessment findings to the correct clinical decision? Most of the time, these questions focus on interpretation or action. For example, you might see lab values and have to choose what they indicate. You might see symptoms and choose the nurse's next priority. Or you may need to complete a sentence with the correct clinical reasoning step. This is not about memorizing random facts. This is about understanding what the data means. So when you see a drop down, first, read the full sentence first. Second, predict the answer in your head. Third, look at the options. Fourth, choose the one that matches your clinical judgment, not just what sounds good. If you can think like a nurse, you will dominate these. Simple format, critical thinking required. Let's go over the sample drop down question. The nurse recognizes the patient is at highest risk for. So, which condition puts this patient at the highest risk? Pause and think. Low oxygen and increased respirations signal a problem with oxygenation. The correct answer is impaired gas exchange due to low oxygen and increased respiratory rate. Remember, ABCs first: airway, breathing, circulation. If oxygen is low, that's your priority every time. Okay, let's talk about highlighting questions. These questions are not asking you to highlight everything that looks important. They're asking you to highlight the key cues only. That means the details that actually impact clinical judgment, the abnormal findings, the safety concerns, the data that changes what you do next. And here's the trap: there will always be extra information. Why? Because in real life, patient charts are full of noise, and the Next Gen NCLEX wants you to know, can you filter it? Not everything matters. Not every symptom is urgent. Not every lab value changes your priority. So when you see a highlighting question, pause and ask yourself, what is the real problem here? What data supports that problem? What would make me act immediately? Highlight only what connects to the clinical issue. If it doesn't change your decision, if it doesn't affect safety, if it's just background information, leave it alone. Remember, extra info is intentional distraction. They're testing your focus, they're testing your ability to think like a nurse, and nurses don't chase noise. They recognize cues that matter. All right, let's break this down. This is a sample highlighting question, and I love these because they test if you can spot red flags. The question says, highlight findings indicating sepsis. So, what are we looking for? We're looking for infection plus systemic response. Let's go through it. Temp 102.4. Yes, that's a fever. Infection until proven otherwise. Heart rate 118. Yes, that's tachycardia. The body is compensating. Think systemic response. History of hypertension. No. Hypertension is chronic. It does not indicate acute infection. Don't click it just because it's medical. White blood count, 18,000. Absolutely. That's elevated. Normal is about 4,000 to 11,000. This screams infection. So what's the pattern? Fever, tachycardia, elevated WBC. That's your early sepsis picture. And this is exactly how highlighting questions work on the Next Gen NCLEX. They're asking, can you separate the stable background information from the dangerous clinical cues? You're not memorizing, you're recognizing patterns. And that is how you think like a nurse. All right, future nurses, let's pause right here. Part one is complete. You now understand the formats. You know what case studies look like. You know how matrix questions function. You know how drop downs test cause and effect. You know how highlighting forces you to spot what's abnormal, and that matters because fear comes from the unknown, and nothing about these formats should feel unknown anymore. The Next Gen NCLEX isn't trying to trick you, it's asking you to think. And you've already been practicing that in nursing school, so take a breath. If you're watching this, this is where part one ends. But don't stop here because in part two, we are going to continue building on what you've learned. In the next section, we will identify and practice several additional formats you may see on the exam, including ordered response, select all that apply, drag and drop, bow tie questions if they are included on your exam. We will also talk about common mistakes students make on NCLEX and go over some key takeaways to help you approach NCLEX with more confidence. So, if you're ready to keep building your clinical judgment and strengthening your test taking strategy, next week, make sure you continue on to part two of the Next Gen NCLEX in 30. And in the meantime, I have a couple of downloads for you to help you study smarter. I created a free NCLEX study tips guide that breaks down how to structure your study sessions and focus on what actually matters. I also included a Next Gen NCLEX cheat sheet that summarizes the key concepts behind the Next Gen NCLEX and how clinical judgment questions are structured. You can download both of them right now. Just check the link in the description below. Use them as a quick reference while you study and while you practice questions. As always, stay safe and I'll see you soon.